toxicity is just a really big problem. The fact is, every baby is born toxic. We live in a toxic soup. If we were to look at the cord blood, the umbilical cord blood after the baby is born, there are over 100 different toxins that will be found in that cord blood. I don't think most people understand that they're passing the toxicity onto their babies. Toxins are exogenous chemicals that are found in the environment. It could be heavy metals, it could be mold, but toxicity happens when your body's innate detoxification capacities are overwhelmed. So you can be exposed to toxins, and for a certain amount, your body's going to be able to process them, and there's not going to be any problems with that. But when you're exposed to either large levels, or maybe you have some genetic detoxification challenges, it's going to be more difficult for you to get rid of everyday toxins that you're exposed to. So toxins are things we're exposed to, but toxicity has to do with how your body processes it. The most common toxins that we see when we test, the number one is actually glyphosate. Every single person I have ever tested for toxicity has glyphosate. Glyphosate is made by Monsanto, the chemical corporation, and it is an herbicide. It kills weeds. When we talk about GMO, genetically modified foods, the way that they're genetically modified is to be what is called Roundup ready. So they have a gene in them that when you spray Roundup on them, it doesn't kill the corn, it doesn't kill the soybeans. It will kill all other weeds and all other plants, but the corn and the soybeans can grow. So glyphosate in the United States is so pervasive. It's in our water supply, it's in the air, it's in the soil. If you are eating cows or other livestock that has been fed corn or soybeans, and those corn and soybeans were GMO, it does just go up the food chain. So even if you are eating organic, it's very important to make sure that you're washing your produce very, very thoroughly. I have 4 patients who live on organic farms, and they still have measurable levels of glyphosate. It's just that pervasive in the environment. But the other things that we're looking at and are very common, heavy metals like lead, mercury, antimony, even uranium, some things that are radioactive. Mold toxicity is very prevalent. And then you have all of the chemicals, that chemical stew that we all live in. The brain is really affected by a lot of these different toxins, and it depends on what the toxin is, what kind of exposure you have, and it also depends on what stage of development the brain is. So babies and children are going to have much different problems than adults. If you're dealing with a baby or a child, their brain has not fully developed. So if they're exposed to certain toxins, it can have profound effects on their IQ as they grow. It's been implicated in ADD, or attention deficit disorder. It's also been implicated in behavioral issues. As you get to be an adult, think more about neurodegenerative diseases. So that's Alzheimer's, ALS, Parkinson's disease. It's also neuroinflammation, and it can affect the neurotransmitters. There's a direct link between toxicity and hormones in humans. Predominantly, this is going to be the industrial chemicals or the persistent organic pollutants because they're endocrine disruptors. And what that means is that they either are preventing your body from making the hormones that it needs, or they may be binding to the hormone receptors and preventing the hormones from doing their job. It's really very, very simple to test for toxicity. It involves a urine test, so you just have to pee in a cup. It's best to do it first morning void because we want your urine concentrated enough that they can get the correct levels. The lab requires a very concentrated sample. It takes a few weeks to get the results back. But once you have the results, then we'll have the answers of what kind of toxins we're dealing with, what is your particular toxic load, and then we can develop a protocol to get rid of it for you. There is a blood test that's recently become available to look for microplastics in the blood. And it's not widely distributed yet, but I have had a chance to do it, and I'm happy to say that my microplastic levels are quite low. I think it's really important that people understand what happens in your body with the detoxification process, because if you understand what's happening, you can understand why I'm giving you a protocol that I'm asking you to do. And anytime you have knowledge, you're more likely to do something. So detoxification can happen throughout the body, but the vast majority is done in the liver. So we're going to concentrate really on that area. There are 3 stages to detoxification. The liver, there's 2 stages. Stage 1 is done through enzymes called the cytochrome P450 system. And in this process, the raw toxins are taken and modified by these enzymes, and they're converted into something called a reactive oxidative species. And the sad truth is that those reactive oxidative species are actually more toxic than the native toxin you started with. So it's very important that you rapidly get through stage 2 of detoxification to make sure you don't stay in that more toxic area. Stage 2 is where you take a molecule. This is being very simplistic, but basically you're taking a molecule and you're glomming it onto that reactive oxidative species. And now you're making that toxin water soluble so that your body can actually eliminate it. Most toxins are actually bound in fat before they get presented to the liver to be detoxified. And they have to be converted to be water soluble so that your body can eliminate them. And then stage 3 of detoxification is actually that elimination. And there are 4 ways to get toxins out of your body. You can get rid of it through breathing, through urine, through sweating, and through feces. So if you think about breathing and urine, that's just going to come out of your body and you're good. It's just gone. If you sweat, those toxins are now on your skin and your skin will just reabsorb those. So it's very important that if you do exercise or you're sweating, that you actually wipe down the skin afterwards to make sure that those toxins don't get reabsorbed. But the worst problem is in the intestine. These toxins are pushed into the intestine through the gallbladder. And if you do not bind the toxins in the gut to make sure that they stay in the gut and actually transit through and you actually poo them out, what happens is there's a system called the enterohepatic circulation, and those toxins get reabsorbed across the intestinal barrier and they get put right back into your bloodstream. So it's like the movie The Groundhog's Day, where you wake up and you're doing the same thing over and over and over again. So it's critical that you eliminate these toxins once you've detoxified them. The detoxification process, the protocols that we put together, are going to take into account all 3 phases of detoxification. We want to make sure that we're drawing the toxins out of their hiding place, that we're presenting them to the liver, and that the liver has all of the raw ingredients it needs to make sure that these toxins make it through phase 1 and phase 2 of detoxification. Once you get to phase 3 and the elimination, it's really important that you're hydrated so that you can produce urine, then you can produce sweat and get rid of them. But in the colon, in the gut, we use binders, things like zeolite clay or activated charcoal or chlorella. All of these molecules will bind onto toxins, and each one binds a different toxin. So unfortunately, there's not a universal binder. Charcoal is very, very good for molds, for example, but chlorella is better for heavy metals. So you have to use a variety of binders in the gut. And once the toxins are put into the intestine, the binder has to be there and ready to capture them and bind to them. And then it's physically a matter that they're bound together as one product, and then they move throughout the intestine and are eliminated. I'm often asked about some of the IV therapies that are hyped to help with detoxification. And the fact of the matter is they're not just hype. They actually do work. The most common ones that we do, there is a very special IV called phosphatidylcholine, or PC for short, way easy to say that. A glutathione, which is a major antioxidant. And then there's something called plasmapheresis. So glutathione, being a major antioxidant, it's also a major player in phase 2 of detoxification. And in fact, in order to get rid of mercury, you absolutely have to have glutathione. So we can give you glutathione either orally as a liposomal form. which is a more bioavailable form if you take it orally, or we can give it to you via IV. If you're getting the phosphatidylcholine IVs, we actually give you a glutathione and B12 and folinic acid as part of the IV. But to get rid of microplastics, the best way to do that is through a process called plasmapheresis. So your plasma is the part of your blood that is not your red blood cells. So if you think about your blood, there's this fluid that the red blood cells float around in, and the plasma is where the microplastics are. So we can take your blood out of your body and then basically clean the plasma and put it back inside you. It's not widely available in the United States. You can get this in foreign countries, Mexico and in Germany and other places like that. It is absolutely possible to get toxins out of your body. But the sad truth is that we're all being exposed to toxins all day long, every day. So it's not a one and done. That's the sad news. The good news is we can actually get your levels down so that if your levels were overwhelming you and you were really sick from your toxicity, we can get those levels down so that it's no longer affecting your life. But you are going to have to do something basically for the rest of your life to maintain that. But it's very possible to get rid of them. The answer is absolutely yes. It's very unlikely that they're going to require the bigger IV therapies and things that we do, although sometimes it may be necessary. But just as an everyday precaution, the first thing that you can do is make sure you're limiting their exposure. Make sure that they are eating organic foods or that you're washing things very thoroughly, and stay away from the GMO products like regular beef and pork. You always would want something like organic grass-fed beef. There are some supplements that they can take. Methylfolate, 40% of the population has a deficiency in methylfolate. It's a genetic deficiency. And there are drops that kids can take if you found out that they had that genetic defect that you could give them that would help them detoxify their toxins. I'm pretty free with sharing with people what I do for detoxification because it's something that I've been actively doing for the past 19 years. When I first tested 19 years ago, I had super high levels of mercury and something called PCBs. It was something I was exposed to as a teen. And so when I found out that I had really high levels of these, I took my detoxification process very seriously. I did the PCIVs, the phosphatidylcholine IVs, approximately once a month for 2 years. But in between times, I also instituted an oral detoxification protocol. Now I will do those IVs at a bare minimum twice a year. That's just maintenance for me. And I do my oral detoxification 5 days a week, Monday through Friday. Currently, my oral detoxification protocol includes products that are made from a company called Quicksilver. They use the exact same phosphatidylcholine that I import from Europe, which is meant for IV use. They take that product and turn it into their oral supplements. The reason that's important is that phosphatidylcholine is a phospholipid, and our cell membranes are all made up of phospholipids. So phosphatidylcholine can actually transverse your cell membranes without any aid. It's just an integral part of the cell membrane, so it just goes in there. So their products use this very purified form of phosphatidylcholine. They then make it into microparticles so that when you swallow it, it's super absorbable. So the protocol that I use right now is a product that they have called glutathione complex. And the base is phosphatidylcholine. There's glutathione in it, but it also has milk thistle. So milk thistle will help with phase 1 of the detoxification pathways in your liver. Then I use a product, it's from Quicksilver as well, called Ultra Binder. And Ultra Binder has 7 different binders in it. So we talked a little bit earlier about that no one binder works for all toxins. And the Ultra Binder has 7 different binders in it. So it's really a pretty inclusive binder. I also have the genetic defect called MTHFR. That is that methylation or methylfolate defect. And I know that because I've done my genetics. So I take a very high dose of methylfolate. That's pretty much what my detoxification protocol looks like now. So the 3 main tenets that you can do immediately to decrease your toxicity would be, number one, decrease your exposure. And you have control over that. Don't drink from plastic bottles. Make sure you're eating organic. The second one would be take supplements that enhance your detoxification capabilities. These would be things like dandelion root, or taking glutathione or methylfolate. All of those are supplements that help your body's detoxification pathways. And the final thing is really to make sure that you are capturing the toxins that get released into your intestine with binders. The binders will mesh with the toxins in your intestine, and they will then pass through together so that you actually eliminate them, you poo them out.